If you are a lady with a cervix, let's talk about this cervical smear of a thing. Come on, one name.
Sista.
Hello ladies, today let's talk about something that is so very essential for women's health, and this is the cervical smear test. As you are aware, January has been all things cervix, and we thought it would be really helpful if we talked about what you can expect during your smear test appointment. First off, it's totally normal to feel a bit nervous, but trust us, it's usually a quick and crucial step for our well-being as females. And here's what you can expect. So you will be welcomed by a healthcare professional, whether that's a nurse or a GP at your GP surgery, or if you have to have this done at your gynecological clinic, then it will be by the appropriate or relevant healthcare provider. The actual test itself is pretty straightforward for the most part, and they should be guiding you through the process, and they're also there to explain and answer any questions that you might have about the procedure. Your healthcare provider during the process will collect a sample of a few cells from your cervix. They would usually use a brush very similar to this to collect that specimen. For scale, I will just be comparing that to, so that's my pen over there, and that's what the brush looks like. Okay, so and they will be using a speculum just to open up the vaginal wall so they can access the cervix, they can visualize the cervix, because a crucial part of the smear collection is also visualizing the cervix. So they will be using a speculum. So this is what a speculum is, and like I said, it just helps to open up the vagina. You get into the vagina before you see the cervix at the end, so the speculum just goes to kind of help open that up so you can see the cervix at the very end there. There are different sizes of speculums, so for those who are a bit concerned, there are various sizes, and you can speak to your healthcare provider about this. There are at least 3 sizes, so you've got the smaller sizes, you've got the bigger sizes, and you've got the medium. Usually they will be applying a gel that comes in a container very similar to this one. Not this is treatment for something else, or sometimes the gel might come in a container similar to this one, and a good generous amount is applied to make it easy, so it shouldn't be painful. It can feel a bit unusual because just by the nature of it, it does feel like somebody is in your personal space, but like I said, it should only take a few minutes. Now, that speculum, I'll open this one just for illustration purposes. So your healthcare professional is gloved, they'll take this out, and as I say, if you imagine that that's the vagina, the jelly, so the lubricating gel goes all over the speculum, and then it is gently guided into the vagina like that, and then that, so it's the aim is to try and explain the different sensations that you might be feeling or experiencing, and to help you know that it's okay, and this is what is happening. So then this is the side view, so that happens, and as that is happening, the beak of the speculum is opening, so which means that the muscles of the vagina that were previously like that, which is their default stage, are open. So we start out like that, and as you open it, it opens up like that, and then it is secured. Okay, so it is secured like that, and at the end you should have the cervix just right there. And then your healthcare professional gets the brush and they insert it directly into the cervix, and then they will do a sweep. They'll do that a couple of times. Again, it's just to explain the sensation that you're feeling and say that it is okay, it is a normal sensation to experience. Like I said, you shouldn't have any pain. It might be uncomfortable, so that gets taken out, and then that's the part of it that gets broken off, put in a container and gets sent off to the lab, where it gets tested for any early changes that might be suggestive of cervical cancer. Now remember, the reason we do this is because early detection prevents more serious health conditions further down the line, and in this case, early detection prevents cervical cancer. Now, post cervical smear, some people might experience a little bit of cramping, they might experience a little bit of spotting, and these are normal. Some women will experience that, not everyone does, but some people will. However, if the pain and the bleeding becomes quite significant, please do well to speak with your healthcare professional to report these symptoms and seek their advice. We can discuss further some of the situations where people might need to go into a gynecological clinic to have their smears done, and some situations why people might experience a bit more pain compared to others. Now, you could take some paracetamol maybe an hour before you smear. If you want to bring somebody along, if that makes you more comfortable, then definitely feel free to do that, and get your questions written down, ask them while the procedure is going on. Don't lay there in worry. If you feel something that you're not quite sure of, just speak with your healthcare provider at the time and say, oh, should I feel this? Is this okay? But overall, try to relax, spread this awareness together, and stay healthy. Bye.
Sista.